Hello, I'm Naomi. I'm one of the naturopathic doctors at Naturopathic Living. I do work with Dr. Debbie Smers, whom many of you may already know. But what I will be sharing with you today will be a mini primer on hormonal health, especially as we progress through life stages. And so I'm just going to share the presentation that I've put together. So just give me one moment. So as I mentioned before, today's talk will be on maintaining hormonal health and happiness through life's different stages. I'm really glad that you're all here to join me for this really important topic because I've been finding that this is a concern that many of my patients come to see me with in practice. So I'm hoping that this will help to clarify some of the symptoms or some of the health changes that you've been experiencing. So I'm Naomi, again, for those whom I haven't had yet the pleasure to meet. I am a naturopathic doctor. I am currently in my seventh year of practice, and I do have a focus in women's health, hormones, and fertility. And since COVID, I have also become a certified menopause practitioner. So I am very well versed in the health and treatment options for women who are within the perimenopausal and menopausal phases in life. So I'm really excited to be sharing what I've learned and the information that I hope will be helpful for you in terms of helping you to make the helpful decisions for yourself in the years to come. So I put together an agenda for what we'll be covering today. So as I mentioned previously, we will be focusing on metabolic health. So, metabolism is very much an overarching kind of umbrella term that refers to all the different chemical processes that occur within our cells in order to sustain different functions of life. So we'll go through typical metabolic changes that many of my patients come come to see me for. We'll also talk about the different underlying systems that contribute to the different symptoms that you may be experiencing. So we'll discuss the adrenal glands, which primarily help us to regulate the stress response, the thyroid, which is the master regulator of all metabolic processes. And I'm sure it's something that may be familiar to many of you. And we'll also be discussing hormones. So the different hormones, what they do in our body, and how shifts or changes in hormones can result in symptoms or changes in your health. And then we'll end off the discussion with different solutions that I utilize in my practice in order to support my patients through the different changes that they experience, whether that's symptomatology or whether it's more from a health prevention standpoint. All right, so I also wanted to mention that I will have a Q&A period following the presentation, so I'm happy to take your questions at that time. So in terms of what our objectives are for this talk, I hope that at the end you'll be able to come from this workshop understanding more about your metabolic health, being able to identify perhaps some of the systems that may be involved in your particular symptom pattern, being more aware of the different tools and lab testing methodologies that you can access in order to dig deeper into your symptoms and in your health, incorporating the most effective strategies for yourself in terms of, picking and choosing from the different naturopathic modalities that I will present based on what you're experiencing, and then ultimately coming from this presentation feeling more empowered and being able to utilize some of these strategies in order to reclaim your health and your joy. So metabolism, again, is that overarching term that refers to all the different biochemical pathways, all the different cellular processes that our cells undergo in order to sustain all the different functions for the sustainment of life. So when your metabolism starts to underfunction or dysfunction, what tends to happen is that we may experience one or usually multiple of these symptoms. So fatigue is a very common one. Poor sleep quality. So what this refers to is, sleeping for 7, 8, 9 hours, but not feeling rested, or you're finding that you're waking up either once or multiple times during the night. So your sleep is quite fragmented. There it can also manifest as irritability or low mood. Weight gain is a very common concern that many of my patients come to see me for. And we'll talk about the different systems that are involved in this. Bloating or digestive dysfunction, another common symptom. Hair loss or hair thinning. Sometimes it may be more like dryness of the hair or higher breakage of the hair. Body temperature dysregulation, so whether that's feeling more hot than those around you or colder, and then also period or cycle irregularities. So the three systems that I do want to highlight in this presentation that all contribute to the the regulation of your metabolic health are the adrenal glands, the thyroid, and your hormones. So I will be going through each and every one of these systems so that you have a better understanding of their role in regulating the different metabolic processes that your body sustains. So first of all, we have the adrenal glands. So these are small bean-shaped glands that sit on top of the kidneys. So what they do is that they help to support fluid balance, which helps to regulate blood pressure. They also produce cortisol, which is the stress hormone responsible for the whole fight or flight response. And we'll also discuss the importance of cortisol, especially in terms of weight regulation or sleep disturbances. The adrenal glands also produce DHEA, which is a hormone that funnels down into the production of testosterone, estrogen, and progesterone. So even though in women, primarily hormone function is taken over by the ovaries, when we approach the perimenopausal phase or head into menopause and beyond, the adrenals then now undertake much more of that responsibility for supporting healthy hormone balance because again during this time frame or this phase of life, that's when the ovaries start to falter in terms of them producing less and less estrogen. And then finally, they also produce adrenaline and norepinephrine, which are neurotransmitters, which can help to regulate mood and vigilance. So the HPA axis stands for the hypothalamic pituitary adrenal axis. And basically, this is a sort of biochemical pathway that connects the brain, which is the hypothalamus here. The hypothalamus is a part of the brain that typically is responsible for all of the like life sustaining um, roles. And then that feeds down to signaling to the pituitary, and the pituitary gland is a small, tiny gland that sits just right between the eyes, right in the center. And let me just go back. And the pituitary is responsible for secreting a lot of the hormonal stimulatory um, triggers. And so we'll talk about that. And then finally, the pituitary does signal down into the adrenal glands where we see cortisol and that epinephrine and adrenaline production happening. So in this diagram here, what we see is the signaling pathway from the hypothalamus down towards the adrenal glands can stimulate the secretion or production of cortisol, which is just on the left. And this cortisol has a negative feedback loop on both the hypothalamus and the pituitary. So, what this means is that when we are highly stressed or in a state of chronic stress, this cortisol production will inhibit the different pathways that are involved in the other areas of the body. So typically what I see is when a patient comes in highly stressed, whether it's more acute, meaning that it's a loss in the family or something that has happened suddenly, unexpectedly, or if it's something that's been more of a sustained stress response, this cortisol will impact hormonal health because at the level of the pituitary, for example, that's where FSH and LH, which are hormones that feed down into the ovaries, help to stimulate estrogen production. So if cortisol is inhibiting that pathway from working at its best, we'll then see a decline or decrease in estrogen production. So cortisol is so important, not only for helping us to build that resilience against stress, but it can also play a role in helping to support other pathways as well. So here you'll see that in states of acute stress, there's usually elevated cortisol, which has that negative feedback loop, and that will typically be experienced as that sort of hypervigilance, feeling on edge, feeling anxious. When stress is when the stress response is sustained for longer periods of time or is more persistent, we tend to see the opposite. So low cortisol, which usually manifests more as burnout. So being very fatigued, very low energy, lethargic, low motivation, and cortisol, when very, very low, can also suppress the immune system. So that's usually where we see, you know, a higher vulnerability to infections and getting sick. So we have already talked about the different functions of cortisol, but these are the additional ones that I wanted to highlight. So cortisol does play a role in blood sugar balance. It also helps to regulate sodium and potassium, which are electrolytes that help to regulate blood sugar. It'll also suppress other non-essential functions, so digestion and hormonal production pathways. And when regulated, cortisol is a very potent anti-inflammatory. So some cortisol is beneficial for our health. It's only when it's too low or too high where it tends to manifest more as troublesome symptoms. So these are very common symptoms associated with dysregulated cortisol. So as I had mentioned, when cortisol is high, we usually see more of that anxiety. When cortisol is low, it usually manifests more as that low mood kind of picture. Whether cortisol is too high or too low, we also see it contributing to weight gain, insomnia, fatigue, that digestive dysfunction. So typically what this may look like is an increase in heartburn, bloating, more gas, because food isn't being broken down properly, nutrients aren't being absorbed, and food is just sort of sitting there stagnant. There can also be brain fog or challenges with focus and concentration. And then there's also hypertension, which is elevated blood pressure. So all in all, you can appreciate the importance of having a very regulated stress response because it can bleed into all these different areas and organ systems in the body. All right, so moving on from the adrenals, I do want to touch upon the thyroid. So this is something that I see very, very commonly in my practice, and unfortunately, it's also a an area that I find is often missed especially when women are being evaluated for unexplained weight gain or that weight loss resistance, which usually refers to that stubborn weight loss. Also, I see thyroid involvement in many cases of unexplained infertility as well. So it is a very, very important gland for us to discuss. So the primary functions of the thyroid gland are to regulate metabolism and energy production. It also helps to regulate the different vital um, systems that help to support the body in in these different sort of like survival areas. So regulating of blood pressure, temperature, and your heart rate. It's involved in growth and development, and again, plays a huge role in maintaining hormonal health and fertility. So, hypothyroidism, which is an underfunctioning thyroid picture, is a condition that I see very, very often in my practice. And how this manifests is typically in the symptoms that I have presented to you here on the slide. So there is that sort of persistent fatigue. So typically my patients describe this as just being very low energy throughout the day. They may feel best, first thing upon waking, but as the day drags on, they feel like they're dragging their feet. So that's something that many of my patients do describe experiencing. Hair loss or just that hair thinning again, that weight gain, weight loss resistance, feeling more constipated or bloated, cold intolerance. So meaning that you feel cold, especially colder in relation to others around you, having to wear a sweater even when it's summer. And, again, this is a very common experience that's shared with me in my work with my patients. Infertility and insomnia also rounding out the typical symptomatology associated with a low functioning thyroid. So, the reason why I wanted to highlight the thyroid, particularly for this presentation, is because it is something that commonly becomes dysfunctional once women start their perimenopausal transition or are well into menopause. So when estrogen starts to decline, that's usually when we start to see an increase in the incidence of hypothyroidism. So there's a huge hormonal connection here that's important for you to be aware of. So whenever I am um, testing thyroid function in my patients, it's so important that we test this entire thyroid function panel. So primarily what I see most often is that when patients go to see their doctor and they go for that yearly annual physical and blood work, usually on that report, only TSH is tested. So TSH stands for thyroid stimulating hormone, and it is what signals to the thyroid to produce more or less thyroid hormone, depending on what the circulating levels currently look like. And as you'll come to understand, TSH or testing TSH alone is not sufficient because it really doesn't get to the crux of how the thyroid itself is functioning. And the thyroid gland produces thyroid hormone in the form of that free T4 and the free T3. So free T4 is your inactive thyroid hormone. It needs to be converted into your T3 in order to exert those active metabolic benefits. So at minimum, I always recommend that when my patients go and get their thyroid tested, that we at least do the TSH in combination with the T4 and the T3. If we want to be more thorough, especially in ruling out Hashimoto's, which is the autoimmune variant of underfunctioning thyroid or hypothyroidism, then we also want to be testing the antibodies, which are the anti-thyroid peroxidase or anti-TPO, and the anti-thyroglobulin. So, what I've been seeing in my practice is despite being tested and the results coming back, showing, quite optimal TSH or thyroid hormone levels. Even with the elevation of the thyroid antibodies, that in themselves can also manifest as those characteristic hypothyroidism symptoms. So even with a normal thyroid, with the elevation of antibodies, patients oftentimes will feel tired. They'll be noticing that hair loss and the weight gain. So that's why it's so important that we really do thorough testing whenever we are reviewing thyroid function. And then finally, right at the end there is reverse T3. So again, this is the hormone that really interconnects with the cortisol or the stress response, because typically what happens is when our bodies are undergoing a stress response, or it's being it's being under stress, then we usually see the conversion of the T4 into reverse T3, which is an inactive thyroid hormone. So what happens is that we see a higher reverse T3 and a lower T3, and because the ratio is more skewed towards the inactive thyroid hormone, we'll also tend to see more of that overt hypothyroidism symptomatology. All right, so hormones. Um, the four here that I have highlighted are ones that are that play a huge role in the reproductive system, as well as in the perimenopausal and menopausal transition. So estrogen or estradiol is primarily produced in the ovaries. We also see it being produced in the adipose tissue, which is fat tissue. Progesterone really only is produced in significant amounts after we ovulate, which is usually confined to more of those reproductive years. Testosterone, fun fact. So women actually produce more testosterone than they do actual estrogen, and we rely on the conversion of testosterone into estrogen in order to support the different reproductive functions, as well as the health promoting benefits. It's also produced by the adrenal glands, particularly through the conversion of DHEA. And then we have DHEA, which is produced only by the adrenal glands. And I will go into each and every one. So estrogen is a huge promoter of fertility. So this helps to support, healthy follicular development, so that once ovulation is reached during the cycle, we are releasing a healthy, fully mature egg that, if fertilized, can result in a pregnancy. It also helps to support body composition. And what I mean by that is when estrogen levels are at their optimal, we see fat depositing more in areas such as the breasts or the buttocks versus around the midsection. So a common shift or change that women notice, especially as they progress through the perimenopausal transition or into menopause itself, is that weight gain will usually concentrate itself around the belly. And so now, we've developed this stomach that may not have been there before, and that can be very disconcerting and concerning for many women. It also helps to support the development and maintenance of lean muscle mass, which again plays a huge role in disease prevention, especially later on. It helps to conserve bone density and therefore reduce the risk of developing osteoporosis, which is a loss of or low bone density. And estrogen also helps to support cognitive health, and we'll see that it also helps to reduce the risk of dementia and Alzheimer's. All right, so progesterone helps to maintain the thickness of the uterine lining, so very important during pregnancy. It also helps to regulate mood and sleep quality. So this is something that is really important to consider, because as women progress into menopause, where cycles and periods cease, that ovulation aspect is no longer occurring, and that's the time frame during which we see the most significant progesterone production. So with that loss of ovulation, we also see this loss of progesterone, and that can significantly impact the quality of your sleep as well as your mood. So typically, women who are struggling with menopause or perimenopause uh, will complain about feeling very irritable all the time or just being very short-tempered and just unlike themselves, and just that sleep quality where you're waking up multiple times during the night or just sleeping a good solid chunk but not waking up feeling well rested. So those are all very common symptoms associated with low progesterone. And then we have our testosterone, which in women primarily helps to support and maintain lean muscle mass, especially in conjunction with weight training exercise. And it also helps to regulate libido and sexual function. And then finally, DHEA, which in women primarily helps to support energy production, mood regulation, and libido. Also, very important in conjunction with estrogen in terms of maintaining that healthy bone density, which helps to reduce the risk of fractures, particularly after falls or injuries. All right, so I've talked about perimenopause and menopause intermittently throughout this presentation. And so here I'd like to discuss what that actually means. So perimenopause is the time frame that surrounds menopause. So for many women, this can be an up to 10-year duration of time before they actually progress towards menopause, which is the complete cessation of periods and cycles. So this perimenopausal phase is broken down into an early phase as well as a late phase. And again, that duration will differ between woman to woman, but typically the early phase is usually manifests in symptoms that are typically due to that estrogen excess because we start to see more of that erratic progesterone production. So you'll see here the progesterone is represented by the blue. So during the reproductive years, we'll see that cyclical progesterone production. But as we enter menopause, we start to see that progesterone production beginning to decrease because the frequency of ovulation is no longer on a monthly basis and no longer occurring as regularly as it was before. And so you can see with the red, which signifies estrogen, we now see that relative excess there. And that's usually when, we see more of those very heavy periods or periods that are much closer together. Some women will see, for example, two periods within a month. So those sort of changes are very characteristic of that early phase. Into late menopause, we tend to see a further decline in estrogen levels, and that's usually where um, women will notice symptoms such as the hot flashes or night sweats, that insomnia or poor sleep quality, the weight gain, the brain fog, and the mood changes. So this diagram here is very is a great illustration of how hormones shift and change dramatically into perimenopause and into menopause itself. So, menopause is defined as being at least 12 months since the last menstrual period. So, after this, women no longer have a cycle or a period. And the average age of menopause in Canada is 52 years of age. So just going back to this diagram here, menopause is characterized by very low or flat-lined um, hormone levels, hormone levels and hormone production. So as you'll see here, progesterone is pretty much non-existent. Again, because we're no longer ovulating, we're no longer producing progesterone. And the estrogen though it's still present, and we'll talk about why that is, you'll see that it's much, much lower, especially in comparison to more of those reproductive years or the perimenopausal years. So, with that low hormone production, we tend to see the adrenal glands overtake the hormone production activity, especially now that the ovaries are no longer producing sufficient amounts or significant amounts of estrogen. So the adrenal glands now take over, they produce more DHEA, which then funnels down into the conversion of testosterone. And then testosterone then converts into estrogen, which helps to support the mood and bone density, but of course, in a much, much lower level in comparison to earlier stages in life. And so when women are uh, exposed to these lower levels of estrogen, they unfortunately become at higher risk for developing heart disease, dementia, diabetes, and osteoporosis. Again, with those low estrogen levels, the hot flashes, the night sweats, which tend to stabilize as we progress through menopause. But ultimately, what we see are those shifts in the metabolic changes that we had discussed at the beginning of this presentation become more persistent and more chronic. So, as despite the body being able to adapt to this hormonal low, unfortunately, that also, again, puts us at risk for developing other chronic diseases, especially later on. And so it's really important to understand, if women on average are going through menopause around 52 years of age, and the average lifespan of women in Canada, I believe, is around 86, that's at least 30 years of being in a very hormonally low state, which puts us at risk for other things down the road. And so it's so important that we are proactive about maintaining that hormonal health even after menopause. All right. So now that we've talked about the different hormones, the different organ systems, now we'll talk about the solutions, and this will outline the different modalities that I use in my practice to support my patients. So we'll talk about the different labs and strategies for supporting cortisol regulation to support your metabolism. We'll talk about hormone replacement therapy, which is something that I prescribe very often in my practice. And we'll also talk about lifestyle and nutritional components as well to round out that treatment plan. So, lab work is so important, especially when you start to experience or notice these metabolic changes, whether that's the weight gain or the fatigue, because many of these symptoms will have overlapping causes. And so it's so important that we understand where these symptoms are coming from, and therefore we test instead of guessing. So in blood work, I always recommend that hormones are tested. So that gives us an idea of, for example, where are our estrogen levels? Are we more in the perimenopausal range, or are we in that postmenopausal range? Because with the different fluctuations, that can help us to pinpoint where you are in that transition. And therefore, if we, for example, decide to use hormone replacement therapy, at what dose are we initiating therapy? Inflammatory markers are also really important because as estrogen levels decline, we tend to see elevated inflammation, which can result in joint pain and that hair loss and such. Thyroid function is an important piece in all of this, and I've already discussed the different components that go into that thyroid function testing. I'll discuss the salivary cortisol in the next slide. And then in terms of other tests that I utilize in my practice, I use the Dutch Complete, which is a urinary hormonal panel, and organic acids, which help to help us to understand the different metabolic pathways as well as neurotransmitters that go into the regulation of cognitive health and mood. All right, so this is a typical cortisol panel. So the collection method is through a salivary sample at 4 points, 4 different points during the day. So you'll see here for this patient, their cortisol is mapped using that solid black line. So for this patient, you'll see that their cortisol is quite low. So ideally, we are within that green range throughout the day, but for this person, their cortisol is quite low. And again, this patient came in for that unremitting fatigue kind of symptom as well as weight gain. So this tool can be really helpful at help us better understand how your cortisol is being regulated throughout the day, and if it's too high, if it's too low, that impacts the strategies that we use in order to get your cortisol back into that optimal range. All right, so regulating cortisol is a key piece in helping to support optimal metabolic health. And so what that boils down to is how are we coping with stress, and are we utilizing or deficient in certain nutrients that help to facilitate that coping. So ashwagandha, which is a very common herb that I use in my practice, can help to reduce or lower cortisol, especially for those patients who are dealing with more of that acute and significant stress. It can be very helpful for sleep and to support relaxation and to alleviate anxiety. B vitamins are often the first set of nutrients to become depleted during a sustained stress response. And they're also so important in so many different pathways within the body that help to support energy levels, red blood cell production, and hormones. So replenishing those stores also becomes important. And magnesium is a very ubiquitous um, mineral now that's kind of been recommended by social media, the news, and friends and family. And so, how magnesium works is that it helps to relax the nervous system, or the helps to calm the mind, and then helps to put your body into more of that relaxed state by releasing or alleviating muscle tension. So it has a very calming and relaxing impact on the body, and that's why it's used so frequently in cases of stress. And then there's also the lifestyle factors to consider, such as avoiding, exercising, especially in higher intensity levels. Not working out on an empty stomach because that can elevate the stress response. And then, of course, also avoiding prolonged fasting periods because of the impact on stress. And this is why oftentimes, after menopause or even during the perimenopausal phase, women who had been utilizing intermittent fasting as a weight loss or as a body composition maintenance tool find that it no longer works to the same extent or to the same efficacy as it did before. And then prioritizing sleep, because when we sleep, we're able to regulate that circadian rhythm, which also helps to regulate cortisol. And then these are different metabolic tools that we can use. So we talked about the importance of thyroid, and the two nutrients that are very key in helping to support healthy thyroid function and healthy thyroid hormone production are two minerals. So that's selenium and iodine. What these minerals help to support is not only the production of the thyroid hormones themselves, but also the conversion of the inactive T4 into the active T3. Maintaining healthy blood sugar regulation throughout the day is also incredibly important, because as we head into the perimenopausal and menopausal phases of life, we also tend to become more insulin resistant, which is a risk factor for the development of type 2 diabetes later on. So helping to regulate blood sugar through, the consumption of protein and fiber. And typically for my patients, I recommend at minimum 60 grams of protein a day and at minimum 25 grams of fiber. Magnesium and berberine are other nutrients that I often utilize to support that insulin sensitivity so that we can also maintain that healthy blood sugar regulation. So the reason why I wanted to highlight insulin sensitivity is that's a big contributor to that belly fat gain, especially as women approach their 40s and beyond, because with that insulin resistant subtype of body composition, with that abdominal adiposity or that weight gain that's being concentrated around the midsection, that type of weight is very resistant to weight loss unless we work on addressing the underlying issues with blood sugar balance. And then for thyroid support, if needed, some of my patients do go on thyroid replacement therapy in the form of levothyroxine, which is a very common prescription, medical prescription. And then as a naturopath, I can also prescribe desiccated thyroid, which helps to replace T4 and T3, especially for patients who are sort of stuck with that underfunctioning or that hypothyroid thyroid gland. All right, so a big modality that I do want to highlight within this presentation is hormone replacement therapy. And again, it's not necessarily right for every single person because we need to consider their health history, their family history before starting therapy. But this is something that I've been utilizing in my practice quite often. And I do see the most significant health promoting benefits and improvements in health outcomes after my patients start HRT. So the FDA or Health Canada approved indications for HRT are for the management of vasomotor symptoms. So that's the hot flashes and night sweats. It is also indicated for vaginal dryness or vaginal atrophy, which is the thinning of the vaginal walls or even the labia. So often my patients who experience this will say that they experience pain or discomfort even after wiping, after going to the bathroom. It's also indicated for that prevention of osteoporosis, especially for higher risk individuals, and ultimately very important in preventing dementia, Alzheimer's, and heart disease. So the best practice for initiating HRT is during the perimenopausal transition. So that's within the 10-year time frame approaching menopause or within the 10-year time frame after menopause is reached. So we kind of have this window that has been well researched in terms of supporting more of that initiation of therapy that comes with fewer risks. So there are different forms of hormone replacement therapy. So in my practice, I prescribe estrogen and progesterone. It's out of my scope as a naturopath within Ontario to prescribe testosterone and DHEA. And so for those prescriptions, when my patients are in need of the replacement of testosterone or DHEA, I usually refer them to see my nurse practitioner whom I work with, who is able to prescribe those options. But primarily with my patients, it's either estrogen alone or estrogen combined with progesterone. So estrogen is helpful for the hot flashes and night sweats. It also helps to support that healthy body composition, that lean muscle mass maintenance, and that prevention of heart disease, dementia, and osteoporosis. When women are on estrogen, if they have if they still have their uterus, meaning that they haven't undergone a um, hysterectomy, whether partial or total, they do need to be on progesterone. And that progesterone helps to thin the uterine lining to reduce the risks of what's called endometrial hyperplasia, which is that thickening of the uterine lining that can predispose or increase the risk for other growths and tumors and such. So for women who have their uterus, when they start estrogen, they need to be on progesterone. And the best form of progesterone for that uterine protection right now is either an oral micronized progesterone or an IUD, which is an intrauterine device which secretes a synthetic form of progesterone, which helps to thin that uterine lining to reduce the risk of that hyperplasia. So the different options for HRT, and again, I'm going to focus more on the estrogen and the progesterone because those are the types that are within my scope of practice. So for my patients, I never prescribe oral estrogens. And the reason why that is oral estrogen comes with the highest level of risk because oral estrogens have been shown to increase the incidence of stroke or blood clots, elevated cholesterol, gallbladder disease. And so, because of that, I never recommend that women, especially who are struggling with symptoms during perimenopause or menopause, to avoid. I always recommend that they avoid the oral form and instead opt for the transdermal forms, which are the patch, the cream, or the gel. So transdermal means that these hormones are absorbed through the skin as opposed to um, taken orally. So the reason why the transdermal forms of estrogen are safer is because they come with a significantly reduced risk for blood clots. They also do not impact cholesterol levels, and they also uh, have a reduced risk for stimulating growth. So whether that's tumors or other other solid cysts. And then again, with the estrogen, we always want to be mindful, especially for women who still have their uterus, to pair it with the progesterone to provide that uterine protection. So whether we utilize the oral capsule or an IUD, that again is up to each and every patient. I always discuss the pros and cons so that whenever patients start hormone therapy, they do it with purpose and with from an informed and educated standpoint. So in women who do need testosterone, typically that's prescribed in a gel form. So again, not taken orally, but rather absorbed through the skin. And then DHEA is available primarily as an oral capsule, but some women do choose to use it in form of a cream. All right. So whenever patients start hormone therapy, I always recommend that we start with a very regular monitoring schedule. And what that means is testing through blood work uh, very regularly in order to ensure that the dose that was prescribed to you is being absorbed well and is resulting in that physiological elevation in hormone levels within the bloodstream, but also that we're maintaining estrogen and progesterone levels within that safe window in order to reduce health risks. So um, in the uh, in the 3 to 6 month period after starting, we usually see the most significant benefit in alleviating the common symptoms associated with perimenopause and menopause. So those are the hot flashes, the night sweats, the vaginal dryness, the weight gain, the mood, and the sleep. And again, I always recommend that we retest at very regular intervals. So every 8 weeks or so until we reach those optimal levels. which means that, we are confident that your current dose is working the way that it should in order to not only um, alleviate or treat the symptoms that you're experiencing, but also to have more of those preventative health benefits. So estrogen, ideally, we see it over 100 to 250, and for progesterone, I usually like to see it above 10, which is more characteristic of those post-ovulatory levels. All right, and then there are lifestyle and nutrition um, habits that are important to maintain as well. So weight-bearing exercise, which helps to support lean muscle mass building, helps to support weight loss, helps to support that insulin sensitivity and the blood sugar regulation, also helps to prevent osteoporosis. So being able to keep up with a very regular exercise routine, extremely important. That sleep hygiene, to promote better quality sleep, to support those cortisol levels. So sleeping in a dark room, no avoiding screen use before bed, avoiding caffeine, especially later on in the day, and then also making sure that your room temperature is not too hot, not too cold, can also be really, really helpful in supporting better sleep. And, fueling your body, I had mentioned before. So at minimum, I like to see my patients consuming at least 60 grams, but optimally we move more towards the 80 to 100, but that can be very, very difficult for many of my patients. And so, we compromise at trying to get at least the 60 in for that lean muscle mass development, that connective tissue support and joint support, as well as supporting metabolic activity. And then protein also helps to support neurotransmitter production, serotonin, dopamine, norepinephrine, adrenaline, which help to regulate mood and mental and emotional well-being. Also making sure that we're getting enough healthy fats. So primarily what that looks like is utilizing plant-based fats, avocados, coconuts, nuts, as well as fish, which are high in omega-3s, can be helpful for replenishing those building blocks that our bodies need in order to support healthy hormone production. All right, so the takeaways. So as we conclude this time that we have together, I do want to uh, express to you that, despite being in different stages in life, it's so important that you understand that, there are tools, there are strategies that you can utilize and that, I can support you with, that Debbie can support you with, or health practitioners of your choosing can support you with so that you don't need to suffer in silence. And why I'm bringing that up is because, when I'm working with my patients, many of my patients, you know, express that they've felt the stigma and the taboo of even having open conversations about their experience and their symptoms, and feeling very isolated as a result. And, I just want you to know that I I'm here to support you and to help you navigate the changes or help you to better understand how things are working and how all the pieces are fitting together so that you can, uh, you know, you're able to take that proactive approach in helping to optimize your health. And so I do hope that you found this session helpful and informative and very educational. And if you'd like to see me or to discuss further, I do have office hours at Naturopathic Living on Sundays, Mondays, and Fridays. I also offer complimentary discovery calls so that we can chat more about what's going on and we can decide if we're a good fit working together.